Hello, everyone, and welcome to this audio podcast series on the Rogue Storm episode. This is the Shientist, and in this series, I'm going to be talking about several aspects of pathology and laboratory medicine. This is another Storm Robotics production, and I'm your host, the Shientist. And so, in relating to pathology automation, I thought I'd talk a little bit about some aspects of history relating to in relating to pathology automation. So, for example, where traditionally or historically speaking, in relating to laboratory medicine and pathology, and at least specifically in hematology and transfusion practices, automation really has various sort of approaches, and from the sort of advances that have been and are made available for sort of laboratory specialists and scientists, for example, sort of in nowadays, historically, automation or pathology automation was in some regard more restrictive. So, for example, there were equipment that related to, for example, cell washers, automated pipetting, and also microplate batch testing, which encompassed aspects that related to reagent dispensing, test aliquoting, and sort of batch reading. And in line to this as well, there was in general pathology, there had been automated sample handlers, open walk away systems. So basically, wherein pathology, the robotics and the automation was, for example, fully automated. So wherein certain investigations and tests that sort of health professionals would request on the front line would require, for example, laboratory specialists to sort of ensure that apart from implementing sort of the day-to-day startup aspects of a particular automated laboratory sort of equipment. There would be those that are referred those sort of automated equipment that are referred to as, for example, open walkaway systems. There are closed walkaway systems. So, for example, where laboratory specialists would have to sort of implement certain aspects of manual sort of startup aspects in relating to the automation, to ensure that for example, if there are batches of sort of samples and investigations that need to be conducted, then basically laboratory specialists and laboratory scientists, for example, would implement sort of closed would implement certain aspects of procedure to ensure that after a certain amount of investigations, after initializing and starting a part of the automated techniques and assays, for example, that after a certain duration, that the automation sort of the automation within laboratory equipment then sort of carries over. So that's kind of so in this context, in pathology medicine or pathology and laboratory medicine, closed walkaway systems are functioned based on where in part the laboratory specialists get involved, and then also the automated aspect of equipment then also sort of kicks in as well. And then we have and then from a historical point of view as well, there are sort of component processing systems, and I'm going to talk a little bit about all of these pathology automated apparatus. So to begin with, I'm going to highlight a little bit of introduction, and the main question as part of this introduction, I thought I'll ask the question and hopefully help answer the question as well, as to why is pathology automation required in relating to laboratory medicine and throughout pathology. So one of the main reasons is security. So traditionally or historically, for example, where test and investigation requests would come through into through laboratory practices, there had been lots of test and investigations that had been done or would have been conducted manually, and in part in some aspects of pathology practices that is still the case. However, in and around, for example, haematology and transfusion, and in aspects of biochemistry, for example, the investigations and tests that are prompted on behalf of patients who require follow-up relating to particular health issues, etc. That in line with that, there had been a requirement, or there has been a requirement in relating to security. So, for example, where to protect the aspects that relate to the patient's identity and confidentiality, etc. The security aspects of pathology medicine and in relating to pathology automation have advanced, so that investigations that are conducted through that are performed through automation are more secure on various fronts. And then aligned to this is the reproducibility. So through pathology automation, owing to for example standard operating procedures, and also sort of the main for example the manufacturers guidelines around implementing sort of the cutoffs in relating to particular investigations. This has allowed laboratory specialists and pathology scientists, for example, to perform particular investigations and tests through automated equipment. That also has encouraged more reproducibility around investigations, which has been a requirement, owing to, again, the volume of investigations that might come in, that might be implemented owing to particular health concerns, etc. And then also there's the result storage. So with pathology automation, normally there's an interface that is linked with the pathology automation that allows data to be held, and this then allows the storage and the data to be integrated in a way so that the laboratory professionals, for example, can look to authorize and validate particular tests and investigations sort of more swiftly and through more integrated sort of interfaces. The storage, result storage around pathology automation has been a requirement owing to once again the volume of investigations that sort of come through into through pathology doors. And then there's also pathology throughput. Obviously, with more investigations that are required, the pathology throughput throughput with a particular automation has allowed more investigations to be conducted, thus replacing some of the manual techniques, and thus allowing a bit more representative sort of practices in relating to investigations that would not necessarily be conducted in any other way. For example, so pathology throughput allows automation. Pathology throughput allows automation to actually run several numbers of investigation rather than, for example, one at a time. And then also in some areas of pathology practices, though very rare anyway, the error reduction through pathology automation has allowed again a sort of a reduction in sort of errors being conducted, errors being identified or conducted through pathology automation, more so now than where previously manual techniques had a requirement, or there has been a requirement for more specialist healthcare professionals to be involved through manual techniques, and thus with pathology automation has allowed sort of more health professionals sort of in laboratory practices to be involved in and around across several areas of pathology practices, since owing to pathology automation being sort of interfaced across different areas, different specialisms. And then there's sort of product liability, which basically is where with pathology automation, this has allowed sort of allows healthcare professionals to document as well as sort of oversee different aspects of laboratory practices through through sort of different sort of archives of tests and investigations that are conducted across specific areas of pathology practices, and in line with this, product liability is has in some aspects of pathology practices has been pretty stringent, and generally um, uh, there are very rare issues or occasions where products in relating to pathology automation have sort of liability issues. But however, um, um, generally speaking, pathology automation has allowed more more investigations to be conducted, owing to ensuring that laboratory practices are in keeping with certain aspects of pathology accreditation, which have to then have to be be in line with aspects of product liability as well. So I just want to highlight a little bit around this in context of an introduction here. And so in relating to sort of the security aspects, pathology automation now has come into play, and has been for some time now, where individual users of in pathology practices in across different specialisms would require or do require sort of password protection, and under that there has been a requirement where for example, there's prevention where it allows with security, there's a prevention of unauthorized access, and then there's sort of facility through pathology automation to allow laboratory professionals to conduct particular audit trails, and also implement control of access levels. So, for example, if there's senior health professionals at particular grades, at particular grade of scientific practice, then health professionals or laboratory scientists for example, lower grades would not necessarily require the same level of access to certain interfaces through pathology automation. And so pathology automation, in line with particular investigations, has prompted the control of access. There's a control of access levels. And then, in line with this as well, I'm going to talk a little bit about reagent verification. And what this is basically where there is there is there's on various through various pathology automation, there is sort of compartments where for example a set number of consumables or reagents are sort of housed as part of onboarding, and basically this prevents the use of outdated reagents, and also where there is a store reagent store reagent data sort of facility that also includes aspects of security through pathology automation. So when, for example, if one a sort of consumable runs out or is running low, then basically another consumable or reagent of the same type and lot number, for example, can be included and also used and so thus allowing a general workflow through pathology automation to be more sort of interlinked with other areas of pathology practice. And so in line with this, or sort of in line with part of the introduction, I mentioned a little bit about a reproducibility, but just to highlight some of the main things around reproducibility is the precision. And under precision is ensuring that through pathology automation that any consumables or reagents that are used are the volume is detected, and the reaction time for a particular test or investigation is number one is optimized, but also number two, it is also where for example there are standard and there are procedures in place to ensure that within a sort of a set reaction, for example, that investigation has the appropriate result to highlight whether it's abnormal or normal versus for example, where the automated equipment, for example, may require some for example another reagent to ensure that it is working to the appropriate standard operating procedure. Then there's in relating to reproducibilities, there's the reaction temperature, and then there's centrifugation, and in relating to centrifugation, in transfusion practices, there are pathology there are automated automated equipment in transfusion practices, for example, where there is a centrifuge sort of attached and linked to the actual automation, so that certain tests and investigations where centrifugation is required, there's less requirement for laboratory professionals and scientists to actually, for example, use a separate centrifugation, which may cause sort of time issues for turnaround times for particular investigations. So with transfusion practices, centrifugation has actually been has been important in line with pathology automation. And then there's in relating to sort of reproducibility, there's objective reading. So basically where laboratory professionals are trained so that they can sort of interpret certain investigations through objective reading. And then there is sort of the result storage aspect around this, around pathology automation, which is where most pathology automation is through where there are database systems, and they allow permanent storage of particular tests and investigations. Most pathology automation, irrespective of sort of specialisms, there is approaches where depending on sort of the seniority involved in laboratory pathology practices, there are access to graphical files that relate to tests and investigations of individual reactions. And then there's also access to sort of interpreted reactions, in line with again in line with specific tests and investigations. And then there was also raw data that generally in pathology where pathology automation is concerned, most professionals have access to the raw data that is aligned to pathology automation. And in line with sort of result storage, there is pathology automation has allowed has sort of allowed convenience. It allows data to be analyzed more a little bit more swiftly. There's a little bit more interfaces where there's a management of particular information that pertains to the particular investigations. Again, statistical trend and monitoring as well in most pathology automation. And then there is MS. In relating to result storage, one sort of advance has in line with specifically in line with blood transfusion practices is MS-BOS, which is basically a facility which allows health professionals in laboratory practices to order particular units of blood or blood components, for example, online, where the laboratory or pathology departments are linked with, for example, national organizations such as the NHS Blood and Transplant, for example. And MS-BOS allows sort of better management of blood stocks, and thus in relating to particular areas of pathology automation as well. And then there's an inventory reduction and control, which is always important, because in specifically around storage. And then there's laboratory workload analysis, which allows health professionals and laboratory practitioners, for example, to get an idea of, for example, the number of tests and investigations that, for example, some frontline health professionals would be requesting, for example, and maybe requesting unnecessarily. And so laboratory workload analysis can be assessed through particular areas of pathology automation as well. And as mentioned previously in one of the previous slides here, where the workload analysis can be assessed through conducting particular audit trails as well through pathology automation. And so following this, automation enables a higher throughput per staff member. Automation facilitates 24-hour service, and there is improved sample turnaround time, and can support policy changes if and where applicable, pertaining to laboratory and pathology practices. Workload reduction strategies if required, and in relating to transfusion practices, two main things. There is the immediate spin cross match, and then there's the electronic issue, and both of these are basically sort of implements where automation has sort of carried over where manual techniques, for example, techniques, and for example, that have been sort of semi replaced in some context. For example, where manual cross matches are not, for example, are not done as frequently as they once used to be, or historically, owing to the fact that the processes around particular blood components and preparing blood components, for example, have actually become much safer, as in one, at least in one context, and also manual cross matches for particular patients are only really a requirement from a serological point of view, where patients may have various antibodies, and so the sort of the spin cross match and the electronic issue around in transfusion practices has allowed and does allow sort of an improved sort of turnaround time, so that patients who require particular components of blood is sort of that much quicker. And then in relating to this as well, there is by having a pathology automation, this has allowed and enables a change to skill mix for particular laboratory medicine health professionals, reduces the amount of stress on individuals, wherein they're less likely to leave in some regard, owing to at least in some context, at least historically, where there's in pathology practices, and pretty much irrespective of particular specialisms. For example, there tends to be a good general balance between implementing pathology automation and some of those traditional or manual techniques and particular assays that and that can only be done or conducted through sort of manual investigations. And then also there's pathology automation facilitates sort of multidisciplinary working, in some regard, and this also means that pathology automation moves has prompted moves towards sort of centralized testing and remote issuing. So again, electronic issuing relating to blood transfusion is perhaps an example is one example in that regard. However, multidisciplinary team working through pathology automation has allowed sort of a freeing up time where professionals between different disciplines or specialisms can actually share sort of particular cases or patient cases where for example there may be a disease or condition that overlaps between particular areas of pathology practices, and so multidisciplinary working has become sort of has become more more approachable in at least in some areas of pathology medicine. However, at the same time, multidisciplinary working still requires professionals at other grades, at all grades really, health professionals and laboratory practices, all grades, to be sort of aware of different areas of practice that require sort of that skill as well. A little bit about error reduction in relating to pathology automation. So there's positive sample identification, which is good, so that basically with all pathology automation, it requires sort of patient patient identifiable information may be on, for example, a particular request form, but the request form from a frontline health professional, for example, has sort of barcoded sort of labels that actually are linked to actual tests and investigations, thus then are used to place on pathology in pathology laboratory sort of automation for investigations to be performed. So this reduces, number one, it reduces the error, reduces the error, and also, for example, if you have patients who, for example, have similar names, generally speaking, if as long as if there is a sample that is with the appropriate barcode, for example, then there is less likelihood or less probability for patient samples to be mixed. So there's a positive sample identification, allowing a reduction in the error around this. And then there's bi-directional transfer, which allows a patient demographics, electronic transfer of results, and also check on some validation as well. Also in relating to error reduction, there's objective automated reading, and then there is reagent security. So this allows pathology health professionals to identify whether reagents or consumables, for example, could be contaminated and pick up on that earlier, and also where, for example, some reagents may be required to be onboarded in pathology equipment at certain times of a particular day versus other days. And so, for example, there may be inappropriate reagent onboarding when not necessarily required. And so, in following this, then I talked a little bit about product liability, but generally speaking, manufacturers of some systems undertake responsibility for the safety of the system, safety of the sort of pathology automation, and the condition upon it being operated with strict observance of all the manufacturer's recommendations. So, product liability generally in pathology practices is a sort of a focal sort of aspect in relating to particular standard operating procedures, where all health professionals in laboratory practices generally have to be aware of as well. So I'm going to talk a little bit now about semi and automated systems. So for example, so semi and automated systems can really be can be differentiated by different sort of types of pathology sort of automation. So for example, there are sample handlers and dispensers, and for example, there have been traditionally speaking pathology automation by different manufacturers and pathology sort of manufacturers, for example, and then there's batch readers again that have been sort of developed by different sort of organizations, and there's automated sort of closed systems, and then there's also sort of semi and automated systems in relating to blood component processing as well. And so I'm going to highlight these in relating to for example, giving a general overview. I'm not gonna attempt to go into too much sort of scrutiny over or depth over the kind of pathology automation, but I will give sort of an overview on these different types. So for example, again, sample handlers and dispensers, batch readers, automated closed systems, and component processing. In relating to the sort of main pathology sort of automation that's used, that has been historically used in transfusion, has been for example, conducting indirect or antibody screening, and there have been sort of pathology automation or kit out there that has been developed called ScanGel. ScanGel allows basically antibody screening or indirect antibody screening to be sort of centrifuged in a very succinct manner versus, for example, blood components that are centrifuged. These are sort of indirect screening of antibodies that are conducted in almost pre sort of conditioned cards, where antibodies and components or reagents are separated out into into particular segments of this these cards, and indirect antibody screening through ScanGel traditionally has allowed laboratory professionals to actually identify whether patients will have unusual, for example, antibodies versus antigens, for example, and if required, additional serology can be requested from organizations such as the National Health Service for Blood and Transplant, or NHSBT, if required. So ScanGel is a sort of a basic centrifuge, tiny kind of point of care, almost point of care sort of centrifuge, and antibody and screening facility, where the kit can actually be placed on laboratory or pathology sort of desktops. Then there's another part of so historically, in pathology automation, there is also a ScanGel, another kit by ScanGel, which allows allows the reagents with for example, the original samples that come into laboratory to be housed in its own unit, so that this then allows laboratory professionals to then assess different areas of screening in a more in a consolidated way, so thus away from other areas of pathology practice within a general laboratory, which may have various tests and investigations going on. So this ScanGel unit allows a kind of more consolidated way to conduct investigations. There is, following with ScanGel, there is also a similar sort of a similar sort of piece of a similar piece of kit, which is known as KSAR or KSAR 1, and basically again allows the indirect antibody screening cards to be held on an actual a piece of automated equipment, and there's sort of finite needles that pick or collect sample from the cards, and allow particular investigations to be conducted, and thus allowing health professionals and pathology professionals to kind of go between different areas of pathology practice to ensure that various aspects of practice are covered in a given day. For example, so case R1 has been has been and it is quite a traditional and a historical sort of piece of kit, but has been quite sort of a premise to areas of laboratory practice. Then there's auto view, which is similar to case R, the case R1, but it has other things that other areas of laboratory practice as part of the onboarding in relating to transfusion practices, and I'm not going to go into too much detail about this. Then there's the Diomed ID gel station, which again, from transfusion practice perspective, allows sort of a housing of more indirect antibody screening sort of cards, and again, there is a sort of a finite needle that sort of collects reagent or consumable to sort of conduct particular areas of investigation. And then there's Olympus, and generally and historically, again, it's a much it was a larger, it's a bigger sort of pathology, a form of pathology automation in transfusion or in transfusion practices, but generally, again, this piece of kit has various consumables and reagents, and allows various investigations to be conducted at any one time. Another piece of kit is called is referred to as a biotest Tango, and basically it's a kit that's placed on the bench side in any laboratory, in any sort of pathology department, and used again for areas of transfusion practices. Then there's the Immunocore by Galileo, or IBG Galileo. Basically, this is a freestanding form of a freestanding pathology form of automation, and where generally the Galileo is sort of allows investigations of antibodies, antigens, general ABO and blood grouping, and also allows pathology specialists and general healthcare professionals in pathology departments to ensure that there are enough reagents and consumables to conduct a number of ABO blood grouping and investigations at any one time. And generally, this Galileo, like many other Galileo models of pathology equipment, generally are again freestanding. They're too big to be based on any sort of pathology pathology bench. I'm now going to talk a little bit about automated equipment in related to blood component processing, and one of them is the is by Baxter Baxter Optipress, and basically is this component this sort of automated automated or semi-automated equipment, is allows blood components to be processed so that red cells or whole blood is separated from plasma, and there's various programs that are on this form of sort of automation, which allows professionals to actually ensure that the appropriate component is being sort of processed, and the general sort of aspect around the back Optipress is that there is it allows sort of an integrated part of blood component processing in a way where for example patients who have a requirement for particular blood components are actually after particular pathology investigations. For example, if within a pathology department there are no particular blood components available within a particular pathology department that's linked, that would be part of the a hospital within a particular region, then in sort of where blood components are processed, transfusion specialists and pathology departments can request and order particular blood components from organizations such as NHSBT, where blood components are processed, and they can be ordered, can be requested ad hoc if required, but also where in relating to the general sort of the general sort of Baxter the Baxter component processing pathology automation equipment, or automation equipment. Generally, this allows sort of components to be readily available in an emergency much quicker, owing to the fact that, for example, if in an emergency situation that within a pathology laboratory, if components were to be conducted within pathology departments, for example, then that would cause issues around particular areas of general laboratory practice, but also around laboratory time. And so the Baxter sort of automation or semi-automated pathology sort of Optipress, as it is referred, allows sort of a complete sort of way to integrate areas of transfusion practices from a sort of processing, a component blood component processing sort of route. And then there is another blood component blood component automated or semi-automated OptiPress that allows the blood components to be processed in a bit of a different kind of sort of a different way, but also has similar functions to the Baxter one. So, for example, blood products are produced or developed where red cells are treated carefully and smoothly. Plasma are cell free due to the where these particular OptiPresses have smarter sensors on them, and in relating to thrombocytes, there's a high recovery rate due to particular special sensors within the OptiPresses, and generally these OptiPresses versus the Baxter ones have more application in relating to the filtration processes, and also there are there's with these particular OptiPresses for these blood component presses, blood component processing allows a process integration and sort of operation, a precise separation of particular blood components, and there's more features versus some of the traditional OptiPresses like that of the Baxter. However, again, each of them have sort of pros. So some of the disadvantages to pathology automation include where the instrument there can be instrument failure, which leads to the inability to meet patients' urgent or clinical needs, and a smaller pool of appropriate skilled staff as well, and de-skilling can be problematic and leads to can be problematic, and can lead to increased likelihood or probability of error in complex situations, and de-skilled staff are more likely to leave where pathology automation gets more sophisticated, for example, and that being said, more qualified health professionals from laboratory practices can also potentially have a prompts to have prompts or premise to sort of leave where pathology automation can be quite sophisticated as well. So generally there's some general disadvantages around pathology automation as well, and so in line with this, there is also pathology automation prompt staff time and resource to be sort of compromised, and through pathology automation is that can often reduce staffing inappropriately. And pathology automation, in some regards, has historically been viewed as a panacea, but actually it's not. And non-staff costs can be increased, and so there are some general additional disadvantages. Yes, so I'm now going to highlight a few points related to future developments. So automation that learns from previous workload. That's one of the aspects of pathology, general pathology, that have actually been implemented, and have come into different areas of pathology, and automation that learns from patient-specific experience as well. That is where more future research and developments are required. Automation that validate data against external databases is and has been a future development across different areas of pathology as well. And this includes, for example, where hospital numbers or identification can be used to cross-reference in relating to central blood service databases, and generally between sort of specific national health services, for example, in particular regions around the United Kingdom. For example, laboratory practices, at least where transfusion practices are concerned, do use the same sort of ID information. For example, NHS National Health Service number, for example, which is used as a cross-reference. However, that being said, generally, when samples or specimens, for example, relating to particular complex investigations are labeled, for example, then sent away, for example, for additional serology, at least where transfusion practices are concerned, then generally at the larger laboratories, there are separate ID and information that is used specific to serology, for example. And so automation that validates with and aside or aligned to external databases are yet to be sort of envisaged in a more sort of integrated way. Cross-reference of antibody identification with external databases are also areas of development where pathology automation could be advanced or enhanced later. And in line with this, also integration of automated blood transfusion systems into general pathology and whilst there have been advances around this, they're still generally sort of consolidated. Integration of laboratory automation into an overall blood safety system from bench to laboratory, from bench to laboratory, are still a requirement to some extent. And the introduction of a universal red cell product, a red cell product, has negated the need for most laboratory pre-transfusion testing, which in a way has been implemented to some extent, but again, where for example, those laboratories that are sort of attached or linked to a particular NHS or National Health Services versus a national sort of those national organisations, there is still sort of lack of sort of links, lack of sort of integrated pathology automation that allows allows investigation to be sort of followed all the way through, based on, for example, the same sort of barcoded information, rather than one or two, rather than having several barcodes or information, and the red cell product, the red cells or blood cells has prevented laboratory again pre-transfusion testing, which in a way has been good, but more future developments around this are still required. Component processing has sort of prompted safe transfusion practices as well, and generally investigations investigations as well as inspections are conducted in particular areas of laboratory practices, and in areas of blood component processing departments, where for example, if practices are not according to particular standard operating procedures, then generally speaking, this can compromise certain areas of service. So having said that, components being processed within sort of at organizational level, and not within areas of laboratory practices specifically, has allowed us safe transfusion practices as and when a patient may require particular blood components as part of their care pathway. So just a few points of references and acknowledgements, just to highlight that through this audio podcast, I had referred to in part the International Society of Blood Transfusion ISBT Science Series 2020 as a special issue in relating to introduction to blood transfusion from donor to recipient, and is available from the ISBT website. I also referred to a publication by by Sachs in 2010. A little bit, although the publication is a little bit dated. It's an overview around collection, production, and storage of blood blood components, and it's a book chapter in a Springer publication, and it is available to download by using the link, and so it's available online. Acknowledgement to Malcolm Needs, transfusion scientist and practitioner, England, UK, for the approach to haematology. Acknowledgement to Professor Ken Jones, Emeritus Professor in Immunology, UK, for the immunology perspective, and acknowledgement to Julie Molloy, NHS Blood and Transplant, UK, for the perspective around blood and transplant, the blood and transplant perspective. So thank you for taking the time to tune in. So thank you for taking the time to check out this audio podcast in this series, the Rogue Storm episode. This has been the Shientist, and this has been under another Storm Robotics production, and this was an audio podcast on pathology automation. The next audio podcast I will be talking about or highlighting some aspects relating to massive transfusion regimes, and how those are sort of dealt with, and thereafter I'll be talking about pediatric transfusion, then pre-transfusion testing, and then the provision of blood for bone marrow transplant recipients or patients, and then the use of plasma products. And also the final audio podcast in this series will be around thrombophilia. So again, thank you for taking the time to tune in on this audio podcast. Hopefully catch you on the next one.